Hola a todos. Hi, everyone, and welcome to the New York City Latinx Gay, Bi, and Trans Men's Health Rally 2022. Antes de empezar, quería recordarles a las personas que hablan español de que nosotros tenemos servicios de interpretación available. Si es que se van al menú de Zoom, en el pequeño mundito que dice interpretación, ustedes pueden ahí cambiar todos los lenguajes que tenemos. Así que si es que necesitan servicios de interpretación, por favor, siéntanse libres de usarlos. Ok, entonces vamos a empezar. Uh, Today, we are going to be talking about HIV awareness and building connection through social networks. The first thing that I want to do is just give a quick overview of what the health rally really is. The New York City Latinx Gay, Bi, and Trans Men's Health Rally is an initiative that allows a safe space where we can discuss ways to improve services, as well as strategize how to overcome health challenges and really unify our efforts to end the HIV epidemic. Additionally, we will address issues related to stigma, as well as develop a common vision to address health disparities in the Latino, gay, bi, and trans men communities. As I said, today we will be talking more specifically about HIV awareness and building connection through social networks. And tomorrow we will be talking about community resilience and mentorship. So the first thing that I'm going to be doing is going to be introducing our fabulous panelists that we have today. So the first one is going to be Jesus Casado. Hi, how are you, Jesus?
Thank you so much for having me, Frank. Doing pretty well, thank you.
Yes, so Jesus is a community casework manager at the LGBT Community Center. In this role, he is responsible for the advancement of case management, community-focused programming, and supportive direct services, which seek to improve the quality of life and access to care for LGBT, TGNC, POC, and immigrant survivors of crime and violent crimes by providing trauma-informed care, as well as safe and affirming spaces for healing and empowerment. Jesus first joined the center in 2018, serving as a capacity building coordinator for the New York State LGBT Health and Human Services Network, also simply known as the Network, where he co-administered a coalition of 72 plus LGBT-focused organizations and programs that provide a wide range of health and social services to LGBTQ plus New Yorkers and their families. We are very happy to have Jesus with us. Our second panelist that we are going to be having today is Raul Marca. How are you, Raul?
Hi, Frank. Thank you. Thank you for having me today.
Of course, of course. So Raul is a program manager of the Sexual and Behavioral Health Program at Wyckoff Heights Medical Center. With over 6 years of experience in the HIV vertical, he does field work with vulnerable populations, including immigrants and the LGBTQI plus community. Raul is working on his bachelor's degree in public health at Hunter College in New York City, right here. And he constantly seeks and identifies opportunities to develop more efficient processes. And he has an acute attention to detail in professional and school assignments. He has been an ambassador for the CDC's national campaign, Let's Stop HIV Together, by disseminating HIV messaging materials and other CDC resources in the cities most heavily affected by HIV, and aligns with the jurisdictions identified in the Ending the HIV Epidemic in the United States initiative. He remains a leader, supporter, and role model, inspiring others to continue the resilience. So we definitely want to thank Raul for being here today. And finally, but obviously not lastly, Mateo Guerrero Tavares. How are you, Mateo?
Hi, everyone. Thank you for having me here today.
Awesome. So Mateo is a TGNCIQ lead organizer at Make the Road New York, where he runs the leadership school program. He also develops movement curriculum for liberation and supports organizing spaces for TGNCIQ communities in Jackson Heights and Bushwick. Since migrating to the United States, Mateo has come out and embraced his identities as a transgender man of color and a queer immigrant in order to organize and fight for immigrants, people who are in sex trades, and TGNCIQ communities of color. Mateo focuses on intersectional politics that recognize complexities of communities regarding race, class, gender, and age. So those are our panelists, and I definitely want to thank each and every one of you, not only for being here, but also for the work that you do. I think we all understand what important work this is, especially for our communities who are often marginalized, and just finding that intersectionality between those communities. So what I want to do first, before really getting into the questions that I have for you guys, is I want to just give a really quick definition to what social network means, right? The webinar that we will be talking about today is HIV awareness and building connection, really, through social networks. And when we hear the word social network, we often, especially nowadays, we think we refer to internet, right? Like internet apps, social networking in that way. But really, because of sociology, we have another understanding of what a social network is. And a social network is a social structure made up of a set of social actors, such as individuals or organizations, from two or more people, and really its interactions. So that's what we will be talking about today, how to build social connections, not only on the internet, but also in real life. So the first question that I want to start with is some of the basics, right? Or some of the fundamentals of what strong connections are. So for you guys, what are some of the fundamentals to building strong connections between our communities? The first person that I want to start with is Jesus.
Thank you, Frank. Yes, so I can speak on my experience, I guess, in terms of connecting with communities and building that rapport and that trust and that relationship. I think we often have to look inwards as providers on our protocols, our practices, and what are we doing to really welcome the community. Representation is key when it comes to service in the community, but not only representation, because sometimes we get stuck in the representation aspect that can lead to tokenism, which is where when we hire staff that look exactly like the community, but we don't give that staff the power to make decisions and to change the organization's culture so it can really embrace different cultural dynamics that community bring. So I think we need to move beyond that and actually lead to equity and also diversity within the decision making that happens. And I think that can lead to more inclusive programming that is more culturally sensitive, that's linguistically sensitive. Sometimes we assume that people speak English, and we don't even provide materials in Spanish, or even if we do in Spanish, it's poorly translated, so people don't really get the message. And culturally insensitive sometimes. So we really need to focus on affirming spaces that really address the experiences. So for instance, if we're talking about immigrants, the experience of the immigrant, and really creating spaces that really are relevant to those experiences. So I think that's one of the big ways in which we can build a stronger connection with community as we're providing services that are fundamental.
Awesome. Because what I'm hearing is, obviously representation is great, but also you said that, we need to be involved in the decision making, because after all, those are sort of our lives, it's the lived experience that we have. And it is really easy to cross that line between tokenism and representation, right? I think that's an excellent point that you just made. I definitely want to hear a little bit more from Raul and Mateo. Maybe we can go to Mateo first, but I also want to encourage all of our participants who are here right now to drop their names and their affiliations on the chat, so we are also able to see where you guys joining us from, as well as maybe your opinions as well. So Mateo, how about you start us a little bit on for you, what the fundamentals to building strong connections between our communities are?
Thank you. I think that's a very important question. I think the way that I like to think about it, so I'm an organizer, I've been an organizer for a minute. And I remember how I got connected to Make the Road. And it was one of my friends invited me. And then there was a group of young people in the conference room, and they were talking about the New York State Dream Act, and they were talking about being undocumented. And they were chanting undocumented and unafraid. And, you know, and there was a lot of energy in that space. And at the beginning, I was like, oh, shoot. I'm in a space where everyone is saying that they're undocumented. Like, what if anybody hears us and then like we all get like raided, you know? So I was freaked out. But I think that moment for me was key. And I think for me, it clicked that it is by sharing our personal stories that we're able to build connections and that we're able to bring in more folks into the movement. And so for me, for this like years of organizing and as we continue to do work in the city and the state, it's all about how do we create spaces where people feel comfortable sharing their personal stories so that we can really dive in deep into what are the needs of our communities, how can we support our community members so that our members stay long-term, right? So that folks who are joining Make the Road and are organizing, that they stay for a long time. And so part of building that network is providing space for people to tell their stories, to feel comfortable. And I think about like, well, we want to make a space where people can break bread, right? That people can eat and talk, you know, that people can listen to music that is that reminds them of home, that reminds them of special moments, right? Like all these cultural aspects. So beyond just having a physical space where people can connect, also having all the cultural connections so people feel comfortable and feel wholesome. And I think the third and last part is like building social services for folks, right? So if we're, I think, and I'm saying again that I'm coming from an organizing perspective, if we want people to organize long-term, we need to meet their immediate needs. So if it's legal immigration services, if it's legal representation to make a complaint with the Commission of Human Rights, if it's related to connecting them to health insurance and how to register, like all these different things, like as we are creating this hub for folks to be able to talk about their experiences and think about how they want to change policy moving forward, that they also have the support of services to help them connect long term. And I've always thought about this as like human rights start with food, with water, with spaces to connect, because that's where we start to build from.
Thank you so much, Mateo, for that answer, because you're right. You know, like the basic needs or sort of the fundamentals need to be covered first. But also, what I'm hearing from you is that, you know, we definitely need to allow our communities to be vulnerable, you know, and to really be able to show their humanity, and they often do not feel comfortable enough to do so in a lot of spaces. So it is really our job to create those safe spaces, which is sort of what we're doing or what we're trying to do here right now as well. I want to hear from Raul as well on what the fundamentals for you are for, you know, building and keeping these communities afloat.
I think I'm very like, I feel kind of the same like as Mateo, like saying like build this type of spaces. For example, in my experience too, like I start in this field participating in a group space. So that's how I started in this program. So I think that something that we need to connect more with our community is to look for that community, because our community has been changing a lot. It's not been sitting down here in the office. No, we have to go out. We have to go out, look for them. Because our community is not the same like as 2 years ago or a year ago, and bring those people to our spaces, make our organizations to make those safe spaces. So I know because the pandemic of COVID affects a lot those places, like to make those spaces, but we have to push on, like we have to make those spaces available for them, because after the pandemic, all that changed. All the community needs more things. Where I can look for them going out. I'm a person who likes to go like to check around that area. For example, here on Wyckoff, and the way we kind of try to connect with people is like doing social media, talking to people with dating apps, so we can see how the people their needs from those dating apps. So try to listen from them. So I think that's something like we need to look for it. And then it's very important because the people is always they need to say something, and that's why we're here for them.
Yeah, yeah. No, thank you, Raul, for
Mhm.
that answer. I guess a little insight for the people, for our participants, and as well for our panelists. Raul used to work for the Latino Commission on AIDS, and
Yeah.
I definitely, the first time that I went there, Raul was there.
Yes.
So I definitely love that every single one of the panelists here have that experience, you know, that one-on-one direct services, sort of on the trenches experience, which is so needed, because that's sort of where you actually connect with humans. You know, that's where you actually make those meaningful connections, where they are able to really see that someone else cares for you, right? I think that connection is very important, and that connection got lost a little bit during the pandemic,
Yeah.
if really everyone here agrees. And that's sort of where I want to guide the conversation a little bit more to our second question, which is how was connection between our communities affected by the pandemic? But not only that, but what are some of the ways in which our communities also stay connected during it? I think all of us, you know, also stayed within our organizations during the pandemic. So I definitely want to hear some of the ways in which you guys were able to keep those communities afloat. I want to start this time with Mateo, maybe.
Yeah, I think that there's a lot to this question, and so I think I'm gonna try to go in order. I think first part, I think the beginning of the pandemic, it was how do we immediately respond to the situation so that our folks can stay afloat, as you mentioned, right? And so I think one of the very first thing that we did and Make the Road was we created something called the Bike Brigade, which was a volunteer of cycling folks who will get food from our food pantry and deliver it to communities that are immunocompromised or that had any challenges in going into the streets. And so that was the very immediate response. And understanding that we needed to continue to have meetings and spaces where people could talk about what they were going through, that wasn't physical. So we moved into Zoom. We started having Zoom meetings weekly. And surprisingly, there was a lot of community members that were participating. I think there was a craving to stay connected, right? Like we were all staying at home. We were all kind of like in isolation, but with the desire and need to stay connected. And so we transitioned immediately to an online platform and support group. And so we had different sessions where we will talk about what was going through the pandemic. We had other sessions about like services that we were providing. We had other sessions about know your rights, because we know that particularly a lot of the trans folks in our community were being blamed for the pandemic in their own households. And so we had to do a lot of like know your rights trainings and how to respond to other landlords that were harassing them, right? Like many of them weren't allowed to use the kitchen or weren't allowed to use the bathrooms, and they had to go to the bathrooms in other stores. And so it was a lot of trainings. And I think through that, by transitioning online, one thing that was very interesting is that not only did we have folks that identify as trans in the Jackson Heights areas join us in the meetings, we also had folks from New Jersey. We had folks from the Bronx. In the last meeting, we had folks from Mexico joining the community meetings. And one of the things is really beautiful because people get to connect across, like beyond borders, beyond like train lines, right? And just for context, our community meetings are all in Spanish, and they primarily are focusing on trans women over the age of 21, 22 years old, but it is open for anyone who identifies in the TJNCIQ umbrella. And so I think I will say that those spaces were important. Now, when it comes to like the social networking, I think the city and the state could have had better responses for our community members. I think there is so much our organizations can do to provide sustainability for our communities during moments of hardship. And I think that one of the things that comes to mind is like, yes, we were able to win a fund for excluded workers at the state level, so that undocumented folks that didn't receive any relief through the pandemic were able to tap into it, including sex workers and folks in the entertainment industry and the gig industry. But I think the city and the state can do more. right? So when we think about housing, for example, the reason why a lot of our trans folks were impacted by COVID is because in here in Jackson Heights, we all are living one on top of the other, right? Like it is really impossible to pay for rent in New York City. And so if there were programs that provide permanent housing to folks that particularly prioritize trans, non-binary folks and queer folks at the front of that line and provide permanent housing, we could reduce some of the we could have reduced the impact of COVID in our communities, and we could provide like long-term care. And I think also in terms of like in the beginning of the pandemic, it was really intense. We had many of the transgender women. One in particularly, I remember she called me because the ambulance arrived to her house, and the ambulance was like, you know, like you are gonna die. You might as well die in your house. But the reason why the EMT didn't take her to the hospital is because she is visibly a transgender woman, and he was discriminated against her, right? And we had many cases in which our trans members weren't comfortable going to Honors Hospital, right? And many times I had to bike to their house to check in with them to make sure that they were okay. And so I feel like during the pandemic, there was we were able to provide some sustainability and care for our folks from our nonprofit, but the city and state response could have been better to really make sure that our folks were cared for.
Yeah, Mateo, I definitely agree with that. I think a lot of our agencies had to find, you know, like very interesting ways in which to reach the community. And I think we went above and beyond, but the systems that are there that are supposed to help us really didn't. It's at least what I'm hearing from your answer. I want to hear about this from Raul now. How do you think, you know, the connections were affected during the pandemic, and what is it that Wyckoff, for example, did in order to alleviate that need of connection?
Yeah, the COVID pandemic is very affecting everyone, and they makes very hard to people to get access for HIV prevention or testing or treatment services. So that pushed us to make our organization to adapt with us, to try to make sure like how the people they can get education for HIV or like how we can do outreach. So as I mentioned at the beginning, like one of the keys that we was doing is that using our dating apps, those dating apps, like when we posting all this information, so people they can just at least like chat with someone from the team and talking about sexual health, talking about the services that we can provide or services they be provided by the city because of the pandemic. One of the teams, I want to give an example too, because last year I was part of the CDC ambassador campaign for Stop HIV Together. That makes me to kind of improve more myself to be in social media. So that helps me a lot, like to connect more with my community. And then I was not expecting to connect with not just people around New York City. I connect a lot with people from all United States and outside the United States. And that connection with those people makes me like to know people around all the world to try to get them connected to services. So I feel like the use of social media or use like our platforms that helps our community to get connected with the services. That's why it's something like we try our best here in Wyckoff to like use kind of like the dating apps on the social media. We have an Instagram account where we posting different informations that people they can just read it, see it, and then if they need more, they can just send it an inbox and get the information for us or get a services from us. But this is something like we needed. Like I think that the pandemic moved us like to be like face to face to move something a world like a virtual world. But we have those issues too. We have a few issues because not all the community have those access for those technologies. So we have to explore. We have to continue exploring. That's what I mentioned too in the beginning. Like we have to go out, and at the same time we have to go virtual too.
Yeah, no, I definitely agree with that. You know, our communities had to adapt, and you know what I'm hearing is that a lot came from that adapting process. You know, finding out the fact that we have tools at our advantage that we can use, but we probably have not been using to the, to the potential that they could be used. I want to hear from Jesus about this too. I think that you can provide, also your insight on what is it that we did to really keep our communities connected.
Sure. I think speaking on in terms of the actual challenges, for me, it was a pretty unique experience because I spent part of the of the pandemic, the early year of the pandemic, working for a different organization, and then I rejoined the center. So I had two very different experiences that had a lot of commonalities, but a lot of differences as well. So in my first experience, which was throughout 2020 and part of 2021, I was working for an organization that mostly focused on servicing older adults and immigrants. So you see, once the pandemic hits, as Mateo was mentioning, like funds for undocumented immigrants were non-existent. Like emergency relief was very, very, very limited. So finding other ways, other channels to support the community was very, very important, like food distribution, access to medical care. Also, the first organization that I worked with was not very present on social media. So the pandemic really forced the organization to start building their social media presence in Sunnyside, where the organization is located. So that was, I guess, like the bright side to it was, being able to develop a more robust presence. But then at the same time, there's a double sword edge type of situation here, because you had older adults who have no access to social media, who have no proficiency using social media tools and platforms. So how do you get to them? A lot of these people were homebound. So how do you get access? How do you get them access to care? So that was a huge challenge in moving into a more virtual world. Youth definitely benefited from this because they wanted to be a little more present using their cell phones without having to go to the agency, to our center. And since they were not going to school, then that was a pretty easy way of them to access information. So on that, that was sort of like the set of challenges during my first experience. Then rejoining the center, that's a very different set of challenges. We went from providing full in-person services to actually shutting down the entire agency and only being able to service people virtually. So we noticed that for a lot of our community members, we are the only safe and affirming space where they can be themselves. A lot of students, we have a very robust youth program, and a lot of our youth that were used to coming to the center almost on a daily basis, were no longer able to do that. Our college students had to move back home. And they had to live in, not the best living dynamics, because they had to be with their parents, who perhaps were not very open or responsive or welcoming to their identity. So it's almost like asking them to stay in the closet. And even if we provided Zoom and virtual spaces, we were concerned of outing them. So, we are in a very, very strange situation where we want to provide information, we want to provide resources, we want to keep the connection, but it's really hard because they may not be in a situation where they can easily connect with us. So, and they don't have the physical affirming space for them to do that. So, I mean, we've seen in the news how during the pandemic, gender-based violence had a massive increase here in the city and actually nationwide and actually worldwide. It's because domestic partners who were perhaps in very toxic and physically violent relationships had more exposure to each other because they either lost their jobs, they had to be, they had to work virtually at home. So there was a lot of exposure to that. So it was us trying to find tools and strategies to better service those community members that were more vulnerable for these things to happen to them. So we worked mostly in a referral system. It was mostly us directing people to the few sites that had kept their in-person services. It was also referring people to food pantries, referring people to, facilities that were still providing somewhat in-person medical assistance for people who were being affected by the COVID-19 pandemic. So it was a lot of revamping or reshaping on how we provided our services. And on a brighter side, our social media presence, which was still pretty strong at the center, we were able to utilize that to connect with people who preferred using those social media platforms for communicating with us. So one of the things we did to continue the connection with the community was do storytelling or highlighting profiles. meaning people who were artists, highlighting their artistry, and talking about that, communicating with community members, doing Zoom, sessions, town halls, so we could hear what the community wanted for us to address. So that was like the best way we could use to communicate with the community during the pandemic times. Things have changed. We are in a hybrid model, so we see people in person as well as virtually.
Yep.
We also noticed our insurance navigation services actually exploded. A lot of people benefited from actually being serviced over the phone, and the marketplace being more flexible in the way in which navigators could assist community members. So people didn't have to come all the way from the Bronx to the center to be assisted. They could just do it over the phone. So we see some benefits to having to use a more virtual platform to service for servicing people.
Thank you, Jesus, for that very comprehensive answer, because you definitely, pointed out some of the issues that rose because of the pandemic, or not really rose, but were, extremely exacerbated, right? Because of the pandemic. They were already there, those issues, they just became worse. But also you sort of also touched upon the fact that there is community resilience, our communities have always found ways to connect with each other and sort of identify each other as well. I definitely want to touch a little bit more on that aspect. What is it that came out of the pandemic that we use now, right? I also want to encourage, before I go into the next question, to all of our participants to put their questions on the question and answer section. I believe we have some questions for later, but please feel free to put any questions that you might have to any of our panelists. But yes, as I was speaking, I wanted to talk about HIV awareness, but also just sexual health awareness among our communities. How is it that it was affected by community networks and by the internet, really? I think some of us have talked about some of the ways in which it was enhanced, but also how is it that you saw it hindered as well, right? How is it that you saw it lessened? So I want to ask you all three about that. I want to start with Raul first. How is it that you believe HIV awareness and sexual health awareness was affected by our communities and by the internet?
I think it was in two ways, no? I think it was affected, and then it was a progress. So, because in the way it was affected, it was because starting the pandemic, it was too hard to find places like where we can link our community. But in the other way that it was very like helpful is the way, like, for example, like, I use my social media to put like all the information so people, they can get the information from my platforms. So be a social is kind of like make a relationship with people there in between social media, and then when I was on social media using, like, I was feeling like that connection with them. So that helps me a lot to kind of like to stop or reduce the stress of people that like they feel like to share information. So I put my own image, I put my own platforms to show them like, hey, this is the information I give it, this is what I have, like what I have, what I can bring to you. So for example, was mentioned before, like people there was like send me inbox or send me like message saying like, hey Raul, thank you for sharing this information, it's very helpful for me. Please, can you explain me more about it? Please, where I can get HIV services? I'll be having a lot of conversations with people who just came to this country like last year, like on the pandemic, looking for HIV services because they just getting out of the country. So for me, it was kind of like hard to find a way like to get like information from them, but I get it. I found it. I found the places that people they can get in linkage to care. Being this national campaign from the CDC, that was helping me a lot to connect with those people and explore different ways to connect with them. One example too is that I never I was imagining like to explore like do a podcast. So I was with another two ambassadors from the campaign last year, and we was starting having a podcast. So we didn't imagine that that podcast, it was listened to everywhere. People from Argentina, Peru, Venezuela, there was like always asking us like, oh, why you guys have those information, where I can get this. So we all available, like we kind of like try to available to get the information correct with them, because we don't have all the connections in all our on in their countries. But the most important thing, it was like we put the message, we send the message to our community that was needed. So I think like the use of the social network or the internet, what helped me, like in my side, they helped me a lot to connect with people. But I know like past years, social media, it was a little bit like complicated too, because sometimes if we share something, people they think there's something is bad for you, like it's still the stigma there on if you post any information. But like that's why I always tell them, like it's time to just talk about it. It's not time to hide this type of information. If I'm still hiding, we're gonna still see the like all those barriers of the community. So that's why I take the step up, like to continue talking about HIV stigma and HIV testing.
Nice, thank you, Raul. I mean, what I'm hearing is a little connected with what Jesus was also mentioning earlier. Like Jesus's agency also found a way to share their stories through like profiles. I think we often diminish the fact that our stories are really powerful, and whenever we share them, we lead by example a lot of the times. Just you being your truest self can inspire someone else to also try to get there. So I definitely think, Raul, that's pretty great that you started a podcast, and that everyone from all over the world is listening. That's pretty awesome. I want to hear from Jesus now also as well. How has HIV awareness and sexual health awareness been affected by community networks and by the internet? Do you believe it has been enhanced or hindered or both, and why?
Yeah, in my work, I've seen that the best approach to providing HIV awareness is by both in-person channels and virtual channels. I think it's a combination of the two. I think like campaigns like the U equals U has been so successful because of the social media attention that has gotten, for instance. But then when you are trying to provide access to HIV testing and STI testing, then you need an in-person component, obviously. So
Absolutely.
that was a big of a challenge, a huge challenge for the center when we were completely closed. We were providing home test kits that will like develop ship to people, and they will just get it back. I will pay for the the ship and all that stuff, but there's a lot of logistical planning behind that, and it's not always the best channel for people to have access to testing, because you run the risk of exposing someone's confidential information, or the home kit gets in the hands of someone they don't want to know about the service. So there were a lot of like channels we had to really learn how to better navigate, and the pandemic was a huge learning curve for us on how to better do that. So I do, as I mentioned, as I just mentioned, social media campaigns, PrEP campaigns, access to PrEP, PEP, using social media channels for that has been super important because we're able to viralize. We're able to get to more people that otherwise we wouldn't get to. So even investing or even channeling more funding to social media, paid advertisements helped. I think prior to the pandemic, we would have not even considered to invest as much money as we did just in getting the word out, or having campaigns being advertised on the train stations, on the bus stations, things like that, that we never perhaps thought will be the best channel. Now we're definitely utilizing them more. Now that we're doing a hybrid model, we are able to provide HIV testing in person and access to care in person, but we continue doing a lot of the channels that we put in place during the pandemic, because we realized they were very successful. So there is pros and cons, because there are demographics we're able to reach that otherwise you would have never been able to reach. But then there are demographics that were originally being reached that no longer can be reached because they need that in-person interaction. The same happens with our social groups. We have tons of social groups that are HIV specific, on awareness, people who live with HIV who want to connect with other people who have similar experiences. There is something to be said about having that space be in person. There's definitely a lot of benefits to that, but also, because of the precautions we needed to take for COVID-19, we had to move those spaces virtually, which again, may not be the safest spaces, may be a little more accessible for people who cannot mobilize into the center every single day or once a week. But again, it poses challenges on confidentiality, making sure that people feel safe sharing who they are, on a virtual platform. So again, just as Raul mentioned, there are like pros and cons to moving into a more virtual space.
Thank you, Jesus. And I think you definitely provided a sort of a very balanced, view of what is it that the pandemic brought to us, right? Like what you mentioned, a lot of people who are not being reached before are being reached now, but those who were really relying on that, in-person weekly meeting were not really getting that resource that they really found valuable in their life. So I think that's very important to talk about. I want to hear from Mateo now, because I also know that, Mateo, you are an organizer, right? So that actually means, being with people like one-on-one on multiple settings, like, on a weekly, daily basis sometimes. So I want to hear your perspective on this.
Yeah, I think for one of our challenges was definitely trying to find places for people to get testing. I think very similarly to what Jesus was saying, we started sending at-home kits or giving them the car for them to like purchase them if they didn't want to receive a particular mail in their homes, and so they can go to like the Walgreens and get those testings. And I think so that was one way to solve for that particular issue. The other issue that we had a harder time with was, so our offices were open all the time for like almost the entire day, almost 7 days a week, right? So we always had people drop in, get condoms, and keep it going. And so at the moment in which we shut down the physical spaces for the beginning of the pandemic, it was really hard. So we will get calls like, hey, where can I get condoms? Particularly sex workers in the area who were trying to like access them. And so we were able to set up a scheduling where people can like go into the office and just pick them up. And that was another way to solve for that particular issue. And also during the bike brigade, we also will include like one-pagers about what the organization does and how to access services into the bags that people were receiving from the food pantry, so that they also could like not only get the groceries that they needed for that week or those 2 weeks, but that they can have access to information and services and locations. The one question I did wanted to answer that is related to the prior question and now related to healthcare is that one thing that from the organizing perspective that we learned from early the pandemic is at Make the Road, we've always had like 1 million campaigns. So we had like 3 bills for like workers, 3 bills and a federal bill for immigration. We've had like 3 bills for TG and CIQ. Like for every committee that we have on Make the Road, we've had like 1 million campaigns per committee. One thing that we did during the early pandemic is we said, we're gonna pick 3 issues and all the committees on Make the Road, we're gonna get behind them. And so one of them was rent relief program for housing, the fund for excluded workers, for, again, and anyone who was undocumented, regardless of their industry in which they were working at. And the last one was the repeal of the walking while trans ban. Regardless of anybody's identities, those were the 3 campaigns we were gonna throw down. We were successful. In 2021, we passed the fund for excluded workers. We won the rent relief program for people in New York State. We won the repeal of the walking while trans ban. And so it was a big lesson. And so moving into this year, one of the main campaigns that we decided to pick was coverage for all. And that is particularly related for undocumented folks to be able to access forms of care that is preventive, that is long-term, that is, it also includes like dental and vision care, right? But I think when it comes to undocumented trans folks or undocumented queer folks or anyone who is under the umbrella, many of the fears to access HIV treatment are related to their immigration status, right? And so when our community members see us fighting for campaigns that include them, that include their livelihood, then they are inclined to actually seek for those services and be connected without that fear of deportation, without the fear of implications for public charge, et cetera, et cetera. So in connecting that back into the conversation of HIV it is essential that one way in which we create visibility is by also pushing for state and city legislation that includes our community members.
Thank you, Mateo, really for that, because you really just highlight one of the most important policy issues that we have right now, right, which is coverage for all. And I think, you know, we are all really advocating for it. I also just went to Albany with our legislative team in order to push for that. So I think that's very important that you just highlighted that. And also thank you for highlighting a lot of the best practices of Make the Road. I think, you know, a lot of the participants that we have right now are providers, you know, they work for these agencies and they are always looking for better ways to really maximize their resources. And what you just said is, you know, Make the Road found out that, you know, if everything is important, nothing is important. You have to really put priorities in order for them to pass, and that's what Make the Road did. So thank you for that. I want, you know, speaking of best practices, I'm looking at the time. We have a little more than 10 minutes. I definitely want to touch on this last question that I have for you guys, which is really also connected to best practices. And I want you to keep in mind that, you know, like I mentioned, we have a lot of providers and our participants who are looking for ways to really enhance their community outreach and their community connections. So for you, what are some of the ways that gay, bi, and or trans men can build lasting and meaningful connections with their peers? I want to go first to Mateo, because I know that you're gonna have some great insight, at least, you know, the insight of an organizer, and you can give us some of the things that you found out while you were on the trenches.
Yeah, I think, I don't know, I don't have all the answers, but one of the things that I think about is just that making time for, yes, we have support groups and we have spaces where we offer food and music and people can connect, but also very important one-to-one conversations. I think over the pandemic, that was a big lesson. I think for many of us who have been organizing for a long time, oftentimes we haven't prioritized one-to-one conversations. And I think this was a big lesson as well, like really connecting one-to-one with everyone and making sure that that's the best way that we build long-term connections, right? Not just for folks to continue to participate in the support groups, but for people to participate in organizing campaigns long-term.
Thank you. I definitely agree with you. I've been an HIV counselor, and I can tell you that that one-on-one connection is crucial for keeping people also, you know, just sort of connected to their communities. I want to hear from Raul now. I also know, Raul, that you have done, you know, some work with people as well. So what are your thoughts on this?
I think maintain the communication and the connection with people. Sometimes agencies think they're like people, they're just like, because we have to report numbers, they just focus on just reporting, and then it's not. We talking with people, we talking to our community. So we have to be a good listener, like, because they have needs. And sometimes it's because when we do our own intakes, or when we're doing all the information what we need, we like skip those needs to our community because we just focus on what we have to report. No, we have to be all overall, like we have to listen every single thing that our community needs. So I'm report it, I'm putting it in a report. Why? Because when we want to send this report, the agencies, they're going to see it like, oh, this is what the community needs. Okay, they need testing, they need this, but this is something they're needed too. So be good listeners, be open to the people, like, because we're not on the time, like we're not, oh, I don't see these people. No, we have to be open, we have to be educated. Like we have to go into trainings to be educated too. Because sometimes we see like, oh no, maybe like this is not for me right now, but like we have to, it's not the time to do that. And expand our social networks, expand like our community members. Like I'm being seen here in the chat, like people they're asking, like they're sharing the information. That's a good way to continue helping our community, because sharing that information that helps us to give more services to our community. So thanks.
No, thank you, Raul. I mean, I'm hearing pretty much, that we all want to be listened to. No one really wants to feel like a number. No one wants to feel like the checkbox. I think we definitely need to sort of build that rapport, and that's the way in which you really keep those communities engaged. Jesus, I want to hear from you on this one as well. What are some of the ways in which you have found out that we can build lasting, meaningful connections with our peers?
Absolutely. I think seeing the value in how programs need to be revamped continuously. They need to change because communities' interests, community needs change. We often leave our programming so rigid because sometimes they're bound to a contract, which is bound to funding. So sometimes we think that we don't have the space or the agency to make changes. I think that's super important to really listen to the community. As Raul was mentioning earlier on, the pandemic, or even before the pandemic, the immigrant community, for instance, had very different needs. Depending on whoever is in office, a lot of those needs just continue shaping, continue changing, and our programs need to be a response to those needs. They cannot be so reactive. Sometimes a lot of our programs or services are very reactive and not proactive. So I think, for instance, at the center, a lot of our support groups were very clinical. They were very much bound to a lot of our substance use treatment, our mental health counseling. And then we realized with the pandemic that a lot of people were seeking social groups. They were seeking social spaces just to share, just to vent, especially people who were homebound because they lost employment, the things that I mentioned already. They needed that space just to connect, not necessarily in such a rigid and structured way, which a lot of support and clinical settings do, but more relaxed, where like I can just join in on Zoom or in person and just talk about my life, talk about my interests. So we revamped a lot of our social groups to tailor that. So we have English immigration, Spanish immigration support groups. We have people who are grieving, people who lost family members due to COVID-19. They have a space where they can talk about it in not a clinical way, in a more relaxed, more like, I just want to open up and talk about how I lived this experience. So a lot of these groups are tailoring to those needs. And that's something that I think without the pandemic happening, we would have not questioned a lot of the programming and a lot of the structure and the DNA of the services that we've been providing for many years. So I think that's been one of the best practices, to listen, to not work in silos, to partner, to build coalitions. I think conversations like the ones we're having today are crucial for providers to share resources. I don't think we get the space and the time because we're also overburdened and overworked, that we really need to be intentional about creating these spaces where Raul, Mateo, you and I, and all the providers who are listening can share resources, ask questions. What's working for you? What's not working for you? What can we learn from this experience? So I think just unifying our efforts has been crucial in really targeting and being able to address the needs of the community.
Thank you so much for that answer, Jesus, because what you're mentioning is that you sort of decided to inject human factor into what sometimes feel like, white tiles, white tiles like environment for a lot of the people that we serve. A lot of these people really don't want to go into a place in which they will feel not heard, but also just like sometimes really not attended, or like not really, not like, they feel like people are not paying attention to them a lot of the times. And I think what I'm hearing is, we just need to listen to each other more, which is what each of you have really done so far in the work that you do, which I appreciate so much. Uh, we are right now at the 5-minute mark. I definitely want to get to one of the questions that was asked in the Q&A question, and it's sort of connected to what Jesus just mentioned, which is employee burnout. You know, a lot of the times we want to do this work that is so important to our communities, but we also need to look out for ourselves, right? And for our employees, you know, the people that we supervise or coworkers. So you know, just open to the floor. How is it that your agency is addressing employee burnout or the employee retention issues that we have seen after the pandemic?
Well, I think that's definitely something to talk about. I can think of one of the things I've strategized with my teams is to mirror a lot of the spaces we have created for community to do it for our staff. So actually once a week we have cookie time where like on Thursdays from 3 to 4, people leave their desk, whatever they're doing, and they come to one of our bigger spaces and they just relax, have food. We also have, you know, racial caucuses where like people, depending on how they identify, that's actually part of our racial equity effort internally. People once a month have a space to talk about the impact of a lot of the things that are happening in their identity, their communities, you know, and they can talk about things that are perhaps not strictly related to their role, but just them as humans, you know, because we forget that we are staff, but we're also community. It's one of the tricky things in nonprofit, and especially in LGBT nonprofit, that often it is us who are providers, but also, you know, recipients of a lot of services, or even the oppression that the systems impose on us. We are also impacted by it. So by reminding that and creating spaces for staff, I think that's definitely helped a little bit with the burnout.
Thank you, thank you. I want to hear from Raul and Mateo. I also want to remind our participants, you know, we have a little more time to please complete the evaluation link that we have put on the chat. Luciano right now has been putting it, just so we can know where to improve in our webinars, and also just, you know, show us some love as well right there. Raul, I will go with you on, you know, how is it that YCOP has addressed burnout?
Okay, so for example, like for some of my staff, like every time like we have like a specific like case or something, I always recommend my staff, like if you have to go for a walk, just go for a walk. If you need a time to go, just go get your time to go. Plus, we have here at Wyckoff, we have a meditation room. Like it's a room here at Wyckoff. Like you can go there, just listen like quiet music, just be by yourself there. And this is a good space. Like the employees here, they can just be relaxed and just take out any stress that is involved, specifically here in a hospital settings.
Yeah. No, those are great. Those are great ideas. Mateo?
Yeah, we're doing no emails before 8 a.m., no emails past 7 p.m.
Yes.
And that's like to start, just for starters. But also we provided COVID time for our folks, and that time can look like anything. If folks need to take the day off, if folks need to take a couple of hours, that folks are able to do it without impacting their vacation time or their sick hours or any other like personal time. I will say that one thing that I was going to mention earlier that helps build that helps build relationships for the long term is also one-to-ones, as everyone mentioned here, but also doing leadership development and outreach. I think if we're trying to do this work long term, one of the key things to reduce burnout is increasing our outreach opportunities and then supporting the leadership from the people that we're reaching out to for them to step into these roles so that we transition out from our positions and that they can be the ones to take on this work or to increase the capacity of the ways that we're connecting with community members. So I will say that one way to reduce burnout is definitely by providing leadership development opportunities for folks to grow in staff and to increase capacity. And to also think about this work from a place of abundance rather than scarcity, because I feel like oftentimes we're like, there is no money, but you know what? Let's ask for more money from these foundations. Let's ask for more money to increase our capacity because we actually want to serve our people. Well, the foundations have the money to do that, so like give it in, give it to the community.
Yeah, No, no, thank you, Mateo, for that answer. And that's sort of a great way of really ending this webinar that we have right now. You know, leadership development is extremely important, and that's why we have created spaces like this. So, you know, folks are able to really see the leaders of right now and how they can also get to that point of leadership. And that's also connected to the rally in general and our second day tomorrow, which is where we're going to be talking about how we activate community resilience and also mentorship, which is extremely important. You know, we always have to sort of work with those future leaders who are going to be stepping into our roles. You know, we are not in these roles forever. These roles are going to be taken over by some other people, and we need to start nurturing them now. So I definitely want to invite folks to join us. And for tomorrow's session, I believe Luciano has already put the link on the chat. And I want to thank so much our panelists for their time and their efforts today and always. Raul, Mateo, Jesus, we have worked in, you know, multiple settings, and we have done many of these. And I always learn from you guys, and you know, in every single one of the webinars that we have done. And I definitely thank you for your leadership as well.
Thank you for having us.
And thank you to all of our participants for joining us. I hope to see you tomorrow, and have a great rest of the Wednesday. Take care, everyone.
Thanks, everyone.
Bye, everyone.
Thank you. Have a good one.